As a single mom, it's a lot. Sorry.
It's okay. This is going to save people's lives.
Yeah.
I mean, it truly is. And we're going to be talking about that as we go forward. As Mary Poppins used to say, a spoonful of sugar helps the medicine go down. But today's medicine doesn't just come in pill form. We've entered the age of at-home injections. Insulin and GLP-1s may be the first things that come to mind. But this goes far beyond that. What used to require trips to the hospital, handled by doctors and nurses, are now do-it-yourself injections. But here's the flip side. It's now up to all of us to know how to do a proper injection. That means patients of all ages, from kids to the elderly, are not only expected to take these medications correctly, they're expected to travel with them correctly, track their use and dosage, and maybe most important of all, keep them at the right temperature.
My body doesn't produce any insulin, so I am trying to replicate that incredible process with injections or an insulin pump.
How often, in terms of your conscious thought, do you have to be mindful about this throughout the day?
It honestly doesn't stop. Insulin is very scary. Just a teeny bit too much, and you are having a severe low blood sugar event. Not enough, and you're fighting high blood sugars all day. And imagine, your child being diagnosed at 11 months old or 6 years old. It's so much harder than mainstream society realizes.
How temperature sensitive is insulin? What's the range?
It's so delicate. It's so delicate. I actually, when I was 19, I had my insulin in my pocket, and I was stringing Christmas lights up outside the movie theater I worked at during 10-degree weather in Vermont. And I didn't know it, but the weather killed the insulin, destroyed the insulin in my pocket. I took it that night before bed. All night I wasn't getting active insulin. And I woke up the next morning in diabetic ketoacidosis because my blood sugars were so high.
Shannon McKelvey's daughter was diagnosed with type 1 diabetes at just 6 years old. For the past 2 years, her family has been managing treatment every single day. You know why? Because it's there every single day. Talk about the emotional toll that this takes, not just on your daughter, but on you as a mom manager.
As a single mom, it's a lot. Sorry.
It's okay.
Decision making about nutrition, what we're eating, making sure that she eats at particular times so that she's regimented, being aware of all of the extra unforeseen circumstances that also affect her blood. Trying to understand my now 8-year-old who was diagnosed at 6, her 8-year-old extracurricular lifestyle. Will she be doing activities? Will she be outside in the heat? Managing all of those extra little decisions constantly, and preparing for those and making sure that I have all of the extra emergency things in play, but as well as letting her enjoy her life. She's a child, she's 8, and I want her to have her birthday parties. She's turning 9 on Sunday.
Can you remember the last time you ever took a really deep breath?
No.
Just ever been able to just
Yeah.
just relax? It's hard.
Yeah.
You have to make sure that you've kept everything right temperature-wise so you don't think you've delivered what she needs when in fact you haven't because it's inert.
Absolutely. We actually have experienced this in the short time she's been diagnosed. I actually did receive a prescription that I had to call the pharmacy back and inform them that it wasn't cold And so we were able to go back, and they were wonderful, and they provided a cold insulin pack for us. And we've also done a number of different road trips where I've driven from Canada to Texas and back in the summer when it's 105. We have definitely had to make preparations to make sure that the locations that we're staying at for the evening are going to be able to have a place for me to freeze ice packs or stop at gas stations that will allow us to have Ziploc bags filled with ice so that I can put those in a cooler in the car. And then make sure that, if we're on flights where the device that we're using is also permitted on the airlines, so that we aren't too close to ice packs and that it's not freezing or overheating.
How much stress would it take off of you if there was a system that supported that, anticipated every one of those needs, and provided you with that technology so you didn't have to find somewhere that had an ice machine? How much would that help?
It would be amazing.
I'm here now with Ron Nager, founder of Tempramed, and Julia Becker, his vice president. Listen, you're the brand builder here, but Ron, you're the one who came up with this brilliant solution, and we talk about it as the last mile. So tell us about this. What motivated you to do this?
Well, several things, I think. First thing is that my father was a type 2, so I realized, he was diagnosed at the age of 70 until 84 when he passed away. He had to inject several times per day, and I was aware to the burden that it brings to him and to my mother that has to take care of him. Second, there was another guy that I met with the industry, using a pump, and he told me that while he was doing that, he forgot that his vial that is used to refill the pump, while the pump is on him, the vial is not. And he lives in California, so very often he just left his bag in the car. And the next day, when he was using the pump, the insulin or the blood glucose level was not where it should have been. And the fact that I realized that for many years, insulin companies were trying to find a solution for heat-stable insulin. But as an engineer, I took a different approach and found a device that can address not just the problem for insulin, but for all other medications.
How hard has it been to educate people to realize just because you're taking a medication doesn't mean it's effective?
It's been very important for us to make sure that patients are educated and actually know that their insulin, or any injectable for that matter, is temperature sensitive. And it's shocking to know that a lot of people don't actually realize that the injectable that they're taking in high temperatures, summer or winter, is actually compromised most of the time. And that's a huge problem as well, because the industry and pharma isn't educating people on those issues either.
That's what I mean. You don't hear people talk about that. I mean, it's buried in the information.
Yeah, it's buried.
In the instructions, and it's got to stay within range. It's absolutely critical. What exactly does Tempramed do?
All the patient has to do, basically, take this is an insulin pen. That's the drug compartment or the insulin compartment. It comes with a cover, with a pen cap. So for the temperature protection, what is required is to replace the original pen cap with our VV cap. That's all. Now, even if you leave it in your car by accident and it's 140 Fahrenheit, the insulin inside will not go above room temperature. You do not have to make any preparations. You don't have to charge anything or use ice packs or basically you have room temperature in your pocket wherever you go without any hassle.
No power, no charging.
No chargers, no charging. It has a battery that allows you to understand what is the temperature status of the device inside, or what's the temperature inside. You can see here that by pressing this button here, you get a green light. What happens is that there's a temperature sensor inside that measures the temperature every time you activate it. There's about 5,000 activations before you need to do anything. So basically, it lasts for a few years of life. So that's the ViviCap. We have the same technology applied also to larger pens like biologics, for example. It's basically doing the same. All you have to do is put your biologic pen inside, in this case, a Vivimed, and it's protected. And as I said, also the other thing is that people have to record every injection that they make. So the other side of the ViviCap, now we're calling it ViviCap Smart. You can see here has a timer that tells you when was the last time that you took an injection. You use it for taking an injection. Basically, this allows you to avoid injecting too frequently, which is might lead to a severe consequence of.
Can I look at this?
Yeah.
Yeah. Oh, so it has a readout.
Yeah, it has a readout,
Yeah.
and it also connects to an app that every time this goes, every time you inject, the app comes up and asks you how much was injected. You can use voice or just the keypad to punch the number, and that information is now going to be recorded. You can share it with your parent. You can share it with your healthcare professional. So every time you come to the doctor, you don't have to manually register everything.
I want to talk now about solutions. Tempramed talks about space-age technology. So I want to talk about what that actually means, how that technology works without charging ICE or anything external. So Julia, this is, to me, a huge solution to a serious problem.
Exactly. And when we refer to space-age technology, what we're really referring to is technology that's inspired by advanced insulation systems that oftentimes are used in space to protect extreme temperature fluctuations, and oftentimes that temperature control is mission critical. So what we've done is adapted those same principles and used the same materials for a device that works in everyday, day-to-day lives. So a patient knows that they have a device that's not only durable, reliable, but technology forward that will keep their medication safe from the summer, the winter, just any temperature fluctuations, and they go on their day-to-day.
You don't need to prepare. You can be spontaneous and make sure that your meds are kept at all the times at the right condition, even if there are power outages or something else.
And just further to that, just to jump in, because our technology is at core of our products, we're actually in discussions and looking at other critical verticals and channels. If you think of first line defense, ambulance services, military services, hospital services, when you're thinking of blood transfer and organ transfer. So really, because we've patented and this proprietary technology that we have and we've developed, we're looking at expanding our product offering quite substantially across different verticals outside of just medication management.
Congratulations on solving a problem here.
Thank you.
Thank you.
Thank you.
To learn more about Tempramed, visit tempramed.com. All the information is there, and use it. Of course, they can go there and get this and have it shipped straight to them. Anywhere else they can get this?
Our product has actually been validated in market already. So 150,000 individuals have bought our product online through Amazon.com, Walmart, Walgreens, and we're actually working on getting our products in pharmacy networks across the US, which we anticipate towards the end of this year. On a secondary note, we are actually working with a number of large payors, and we're really targeting the insurance companies from an education perspective to start carrying our product for their customers. And it's a very important part of our expansion plan.
This is going to save people's lives.
Yeah.
I mean, it truly is, and it's certainly going to de-stress a whole lot of people.
Yeah.